Now, before we dive into today's video, do not forget to subscribe to my YouTube channel to stay up to date with our videos and free resources. And please remember that you can access our review courses, quizzes, and flashcards by going to nursingcram.com.
Serotonin syndrome is a potentially dangerous condition caused by an excess of serotonin in the body, leading to overstimulation of serotonin receptors. It is often triggered by certain medications, especially antidepressants. It can be caused by therapeutic medication use, as a drug interaction, or by intentional overdose. So some of the medications that can cause it include selective serotonin reuptake inhibitors, monoamine oxidase inhibitors, serotonin norepinephrine reuptake inhibitors, tricyclic antidepressants, and dextromethorphan. Since all these medications can increase serotonin levels, combining any of these medications together puts the patient at a higher risk for developing serotonin syndrome. It's also important to understand that when switching between these medications, patients should wait 5 half-lives before starting the new medication. For example, when transitioning from an MAOI to an SSRI, it's important to gradually decrease the MAOI dose to minimize withdrawal symptoms, and then wait 5 half-lives before initiating the SSRI. There is also herbal interaction that you need to be aware of. So if a patient is on any of these medications, you want to make sure you educate them on St. John's wort. This herb acts as a serotonin reuptake inhibitor, so combining any of these medications with St. John's wort can also cause serotonin syndrome. The symptoms of serotonin syndrome can present with a range of symptoms that fall into different categories. I use the mnemonic MAN to remember the 3 categories: mental status changes, autonomic manifestations, and neuromuscular hyperactivity. So for mental status changes, it can include restlessness, anxiety, confusion, and agitation. For autonomic manifestations, it can include tachycardia, sweating, which is diaphoresis, and fever. For neuromuscular hyperactivity, you will see hyperreflexia, which is overactive or overresponsive reflexes, muscle rigidity, which is increase in muscle tone or stiffness, tremors, and myoclonus, which are sudden, brief, involuntary muscle contractions or jerks. The common findings that are important for you to remember about serotonin syndrome are hyperreflexia, myoclonus, and muscle rigidity. So how do we treat it? The treatment includes discontinuing all serotonergic medications. If it's a mild case, sometimes by just stopping the medication, it can be sufficient for recovery, while moderate or severe cases may need further intervention. These patients may require active cooling for hyperthermia. Benzodiazepines can be used to manage agitation. And the most important medication to remember for treating serotonin syndrome is ciprofloxacin, also known as paroxetine, a serotonin antagonist that blocks serotonin production.
Thank you for watching this video, and remember that you can access our resources, review courses, quizzes, and flashcards by going to nursingcram.com. And don't forget to like and subscribe.